Hey guys, it's Erin here. We are checking in on the training for our Hydrafacial machines. It's one of our newest treatment lines. So we're going to just take a peek at what they're doing in training.
From your experience, what have you noticed, like, with potential, like, just expanding of capillaries and, like...
So obviously that's going to be on, like, a thinner skin. If for some reason you do, break through the capillary, what you're going to do is you're just going to turn down the vacuum setting, and you're going to want to make sure that you hydrate that really, really, really well on your last step.
Okay.
So that heals within the next 30 minutes to an hour. It's going to heal very, very quickly because we talked about that hydration under the skin.
Reduces inflammation.
Yeah.
Okay.
So go ahead and start with the other side. Perfect. And her touch feels good? So yeah, once we get out of that mindset that we don't have to press into the skin, just let the handpiece and the device do all the work for you because we're pulling out as we infuse in. So right now with the extractions, we are infusing in antibacterial and anti-inflammatory properties. So that's going to eliminate that redness, which creates that instant gratification.
And I think on the last training, like, that you were here, this is the step where you took it and you really concentrated, and I saw you did it on that side of the twist and kiss.
Yes.
Okay. So when they have an active one, kind of like Sam had and kind of like I had, you did that twist and kiss where you really concentrated on that area.
Absolutely. Absolutely. So if you have someone who comes in for like a spot treatment, let's say they have like a big event and they're like, oh my gosh, I have this blemish and I don't want to put my makeup on it so it crusts over.
Yeah.
We're going to hydrate that so their makeup goes on flawlessly. And obviously that's going to speed up the healing time too.
Yeah.
So what she was speaking to, the kiss and twist, let's just say she had like a blemish right here. We're going to press down into the blemish and we're just going to twist.
And you don't change the suction or the
You
pressure?
can.
Okay.
If you have something that's stubborn, that's not coming to surface, that's when you're going to pump up the jam, change the suction.
Okay.
Yeah. And sometimes, if you cannot get it out through the device, a lot of times it will soften it up so much that you can do a manual expression of the blemish, absolutely. Or you might tell them, hey, that's going to come to surface by tomorrow morning.
Yeah.
If you don't feel comfortable doing it yourself.
What about for like little milias? Could we lancet them open prior to treatment?
So
something we all get excited about.
Okay, so what we're going to do is we're going to take about a 30 gauge needle. We are going to lance it to create an exit point. Yes,
Okay.
and then we are going to continue on with the signature Hydrafacial and on that extraction portion.
Like so this. So would you want to do the? Would you want to do the lancet first before we even start the Hydrafacial Yeah, that's at what all?
Oh,
she just said.
I would, absolutely, because then you're going to hit it with the exfoliation, you're going to hit it with the acid peel,
Okay.
and then you're going to do the extraction. Same thing for milia. It may not come to surface immediately, but eventually it's going to start to soften up, and our goal is that it doesn't come back.
Yeah.
Because we are we're able to get down deep into the sebum and really create that healing process and less infection. Yeah, it's a beautiful, beautiful thing. Okay, so we are moving on. Nice job, girls. We did our extractions. We're going to kick that bad boy off. Now, this is where we would add in our specialty vial. If we are doing one, we're just doing our signature Hydrafacial for now. We're going to do our specialty vial when your models come in.
Okay.
Okay, so on this one, we can go ahead and just push right through it. And we are on our last step, our Antiox Plus. So we're going to go ahead and change our tip. It's telling us that our Antiox Plus needs to be on. And then we're going to use a feather, dab, and hold. With this one, we are literally going to do this step until the skin will not drink the solution anymore. Yes. So I like to do just a dab and hold just to make sure everything's getting penetrated. You'll notice it's a lot of solution as it's starting to drip, so we're going to want to dial it down so we can control it.
We dial that down on the handpiece, right?
Yes.
Yes.
Mm-hmm.
I usually
50's middle, right?
Yeah, I
Okay.
usually start it at 50%. But you'll notice how the solution is just kind of beading right now on our forehead. I mean, you can see the difference between this side and this side.
Mm-hmm.
And
So this is what we want, beading.
we do want beading.
Okay. And then I'm assuming then, as you said, how much it drinks. Like we'll go through the other half and then the other half, and then if that side is like not beaded anymore, completely hydrated, we could go back over.
Correct. So usually the skin drinks the most right here and the cheekbones.
But we're dabbing, and then we're gonna go back in and feather.
Yes.
Okay.
You guys are such fast learners.
So just like you said, I'm going to go ahead and just kind of let that penetrate on its own. So you can start on the other side, and then we'll go ahead and evaluate and see what it looks like, where she needs it the most. We're going to know exactly how much consumable you took in this weekend with this hydration. Is she pressing?
Not like.
Okay.
If it's dripping, is that too much?
Yeah, a little bit. You may want to dial it down just a smidge. You guys will notice that these solutions kind of have a mind of their own. You know, every treatment is going to be a little bit different. So you're going to be playing with that dial up, dial down through every single treatment.
Is that not enough though? I'm not seeing anything now. There we go.
So in layman's terms, because I'm not an esthetician, what is it that she's accomplishing right now, or what is she trying to do?
We're
Right.
just applying, right?
We are applying, but we are infusing hydration into the skin. And we are doing that through the delivery of the handpiece. So this is the fourth step in the treatment.
Okay.
And we're using, our hyaluronic acid and peptides we're infusing into the skin. So this is what's creating that lasting glow, that radiance she's going to experience for the next 3 to 4 weeks.
Awesome.
Good?
Yeah.
Okay.
She looks great. You actually weren't that dehydrated. Your weekend must have been pretty boring.
You're not a heavy drinker.
I am not a drinker. Had a couple.
So if you wanted to add on LED light therapy, this is when you would do it. Now this is when this device gets a little tricky because it's telling you to add on light therapy and people are going to be like, you guys are going to be like, my lights aren't working. You have to go back to home and you have to go into LED light therapy. Our red is for inflammation. Our blue is for the congestion and bacteria. So we're going to go to red for her. We're going to get our red LED light, and we're just going to tell them to keep their eyes closed. You're going to press a little button on, and this is great because this helps really penetrate that last step deeper into the sebum. And we're going to spend about 2 to 4 minutes on each quadrant of the face. So like I spoke to earlier, with LED light therapy, it doesn't cost you anything in a consumable, but it does cost you time. So
What do most offices charge as their additionals?
you're going to want to do an add-on of anywhere between $25 and $40
Okay.
for LED light.
Cool.
But you'll start to notice that, the skin's just really starting to drink the fluid, and this just helps penetrate it a little bit deeper. Not to mention, after doing this for, about 6 to 8 minutes, you're going to have incredible triceps.
Would we need to put goggles on them
You can,
if we
you
usually
want.
use that in our facials anyway?
Yeah, you certainly can if you want. You don't necessarily have to.
Because we have little teeny goggles.
And the only time that LED light therapy is going to be a must is with those boosting vials, and it's just because we kind of switch between the LED light and the Antiox Plus because we're throwing in a vial, and we'll get to that as the next person comes in. Now, if someone was acneic, I would probably recommend doing both red and blue on them. With the corded LED lights, you cannot do them both together, so you have to do them separate.
Okay.
So what I would do is I would do the red first because that's for their inflammation, and then I would do the blue last to rid that bacteria. Try to eliminate that infection so we can get their skin.
And this is
clear.
for every age group too.
Yes, yes. Like I said, I started treating my son when he was 13. My daughter, who's 8, she even asked for hydrafacials on her Christmas list. I'm like, okay, you don't need one, but we can pretend. So I've given her one, Nick, without the acid peel, you know,
Yeah.
just because she's a total girly girl. But yeah, and then you can go all the way up the spectrum, you know. You can
What about,
reverse
like,
aging.
If it doesn't happen very often, but a KP treatment on the back of their arms.
That's a really good question. So obviously you can treat the whole body, you know, that would be excellent. You know, you can have them flip over, you can treat the back. You can definitely do the back of their arms. Yeah.
How long do we do this for?
2 to 4 minutes.
Okay.
So you'll see that everything's, you know, looks
Yeah.
really, really good. Her skin drank that up really, really well. So as we stop this, I'm going to turn this off right here. I know you guys are invested in your own back bar line, but this is when I usually, you know, add, this is a brand new bottle. Just a moisturizer. This is just a moisturizer with a 40% sunscreen in it. And you guys can use whichever line you're already invested in. Our sunscreen is pretty affordable. I'm going to leave a bunch for you guys too. And it just provides a really pretty glow onto the skin. It's light. It goes under makeup really, really well. Speaking to that, she can go and put her makeup on immediately, or she can stay with a fresh face for the rest of the day. She can come back as soon as 1 week, but we do recommend once a month.
So you finish with the LEDs if they're purchasing it that day, like as an add-on. But
Yes.
prior to the LEDs, we would have put on the SPF.
Correct.
Okay.
So she's complete.
So once we backtrack to the step before, we were dabbing.
Mm-hmm.
Do we go back in and feather with the tip, or do we use our fingers? Because it's a dab and feather.
So you can dab and hold. Obviously, she didn't need a lot of time spent on this step.
Okay.
So what I would do is I would go back in and I would feather if I was doing, you know, a second passage of the face, and I would feather, and then I would see if it's still drinking that fluid. Then I would go back in and I would dab and
Okay.
hold again.
But say we dabbed, we did a full pass. She was like nice and hydrated. Would we penetrate the rest of the solution in before we would do the SPF?
Not necessarily. You can actually combine them together.
Okay.
You know, you don't have to kind of penetrate that in manually and then do the SPF. You can definitely do it together.
Okay.
You may want to give, you know, that last step just a little bit of time to let it just kind of
Right.
neutralize into the skin. But other than that, no, you can definitely mix the two.
Is there
Absolutely.
anything for, like, if we do manually, like, use our fingers just to give them more of a
Like a
basic
fluff.
like a fluff massage? Is that okay, or
Absolutely.
does it make a contraindication of not penetrating?
No,
I would
absolutely.
think that if we're using our fingers and pushing, that we can push.
You
it
can
in further.
definitely do that,
I
and
do
just
that.
know
Yeah,
that this is going to take a little bit of education for, you know, your patients who are used to having that full 60-minute, 15-minute treatment. You know, this is a very, you know, this is an in and out. This is, you know, very time effective. This is a lunchtime menu treatment. We're talking 20, 30 minutes. So those ones who need a little bit more time and you need to fluff it and you need to extend it just so they feel like they came in and they got what they paid for.
Yeah.
Absolutely.
And then also, my next question is, we finished with an SPF, but could we finish with like something else?
Yes.
So like we could do like a TNS serum or okay.
Whatever your heart desires, you can
Okay.
definitely finish with that. We have some other serums, like if they were doing a boosting vial Derma Builder, obviously we have a topical Derma Builder. You know, we would recommend that, but whatever you want to finish with, you're more than welcome to. So let's take a look at the goodness.
Oh yeah.
So we actually did really well for the first treatment. We stayed underneath our 100 milliliter mark, which is incredible. Girl, you're not that dirty. Dang.
Did you get a facial?
Look at you.
No, I didn't.
didn't?
Well, you did that peel.
I mean,
I
you
did
have,
that peel.
you have some dead skin in there, but other
I
than
use
that,
a Clarisonic every day.
Oh,
Wow.
good job.
I mean, you're an advertisement for Clarisonic. Look at that.
It works.
Yeah, so where we really want to be is around the 50 milliliter mark, so about half of this. But this is still under a $22 treatment, so that's great. It's perfect, especially for the first one. And every time, you know, you get a little bit more familiar with it, you'll learn how to control that consumable. If for some reason you've spent a lot of time with someone and you're over that mark, you know, that's when you have that heart-to-heart with them and be like, girl, you are filthy. Like,
Dirty
You are
girl.
you are
filthy.
so
You need to
dirty.
go find a dirty girl.
Yeah, so you guys did great. So you just toss this down the sink and then you're ready to move on to the next.
You're fine.
Or actually, you know what? We need to clean this bad boy. We didn't even talk about cleaning it. Oh, keep in mind too, with that consumable, remember that first step we accidentally did the rinse away solution, so that a lot of that was inside
Probably
there too.
added to that. Okay.
Yeah. So we're gonna go ahead and turn on our rinse away. We
Would
are
we
gonna
throw away that tip?
Yes, we do
Okay.
throw away this tip. But what I usually do is like before I'm cleaning, I just put my thumb over this and I clean it. Now,
Oh, okay.
I will say the one thing that the cleaning cap is really good for is if you're preparing other things. That way you can walk away from the device when you clean it.
Yeah, Chris, I think you stepped out of the room. She said we should keep all of our caps, even for these, because if we ever have to transport it, you just put the cap back on.
Okay.
So just to show you guys how I got here,
Yeah.
remember we're always going to go to Hydrafacial. We're going to go, that's our home button, but we're going to go skip to protocols. We're going to arrow over, and here's your system clean. So again, it's going to walk you through it. It's got 7 pages on how to clean this bad boy, but hold on, we don't have to go through all 7. So we have our rinse away solution. We have that turned on. It's telling us to. It already sets the vacuum at an 18. Between each treatment, we're going to talk about 20 to 30 seconds. So it's up to you. Now this says after each day, 1 to 2 minutes. I really do that on a weekly basis because you are neutralizing and you're cleaning in between each client. You do not need to wear gloves. You're good to go. So all we're going to do is we're pretty much just going to turn this on. You'll notice that it's just kind of cleaning it and neutralizing it through the tubing. This is what makes your job so much easier.
Nice.
And wait, this takes how long?
About 20, 30 seconds in between.
Oh, okay, awesome.
Each
So
one-
like while I'm like walking
Flipping
out
the
to go
room.
get them.
Mhm.
Yeah.
Yeah.
Okay.
Nice.
Yeah, and then when you get into that weekly system clean, you know, you can, you're going to do the vacuum setting on 12 actually. It says to dip the hand piece, you know, into some rinse away. You don't necessarily have to do that. I mean, as long as you stay up with this and you
Wipe
you
it
know,
down?
yeah,
Yeah.
absolutely. So anyway, this is just more information on that weekly system rinse. On the weekly system rinse, you are going to turn it up to a 26. This is where you pump it up. And this is when you're going to walk away for, you know, a couple hours. Or not
So like
hours,
on a Friday.
minutes.
Oh,
Minutes.
okay.
Yeah.
But when you mean like weekly, you mean like at the end of the week.
Mhm.
Okay.
Yep.
It's not the day.
Yeah, or sometimes people do it like first thing on a Monday morning.
Okay.
You know, yeah, or you can do it like the day that like you close down. The waste container, I'm gonna bring you guys some goodies. What I like to do is, I didn't really. I'm gonna get more in there. I'm gonna go get some spatulas. I like just like those rubber scrapers, and I just put like a paper towel over it, and I get in there and I just scoop it on out. Or you guys can just use like a really gentle cleanser inside that. I would probably do that once a week. Flip it upside down, let it completely dry.
This thingy.
Yeah.
Okay.
When we talked about troubleshooting earlier, this is the number one thing. We just want to make sure that this suction is on here and that these puppies are locked. You will notice if you're not getting suction through your handpiece, that's usually the number one reason.
Okay.
Okay? That's right. Lock and
Lock and load.
Okay, so can I go back through like the step by step of just the Hydrafacial?
Yeah.
So I would start here. Okay, so this is just instructions,
This is just your general instructions. So you're
Okay.
going to go right to, yep,
and then Hydrafacial treatment.
which you're already there.
Oh, okay.
Mm-hmm.
So then that would be lymphatic if we were to do that.
It's still just talking to you about lymphatic.
Okay.
Yeah. So if you're doing lymphatic, you start on 3. If you're doing vortex, or just starting with exfoliation, you start on 4.
Okay.
Now, no, if you're doing lymphatic and you start on 3, you can't just start.
On
Here.
Well, you can actually, but if you want a little bit more direction in with the system, you are going to go to home and you're going to go directly to your facial lymphatic. And this is the one that's going to give you a little bit more step-by-step instruction of where to start, the 3 to 2 to 1.
Right. But since we're not, we'd go home, Hydrafacial,
Mhm.
page 4,
Go to skip.
or yeah, and then page 4.
You got it.
And then we would click the active 4 on.
Right?
We would hit on.
Yes.
Then we would start our long, fast overlap.
Got it.
And then once we're done with that, do we click that off?
Uh-huh.
Do we have to hit that off, or
Yeah.
can we just go to the next?
You have to turn this, on this device, you have to turn that off.
Okay. Then we would go to acid peel, which is the beta, right?
Nope, acid peel is your vial.
Oh, okay. So then we pop it out,
Mm-hmm.
put it in. Then we would, do we hit any of these?
No, you
Okay.
want all these turned off.
Off. Okay. Then you would hit on, because that's this.
Right.
Okay. Then we would do our small feather-like paintbrush strokes.
Yes.
And we start on the nose.
Yeah.
Because we want it on the nose
To
go
sit
on.
first.
Yep.
Okay. Then we would hit off.
Mm-hmm.
Then we'd go next to the beta. Then we click the beta on.
And we'd switch the tip again.
Uh-huh.
Okay. Well, actually, on the extractions and the acid peel, it's the same tip. It's
Oh,
still
okay.
a small teal.
Okay.
Mm-hmm.
So once that's on there, then we would hit on. Okay. We would do just the T-zone or congested areas, and we can twist. We can like suck and twist or whatever.
Uh-huh.
Okay. Then we do our extractions. Then off. Off. Next.
These are your specialty vials.
Okay.
This is where you do your specialty vial, your Derm Builder, your Brightenol, or your connective tissue growth factor.
And we're gonna use that on our models today, right?
Yes.
Okay. Then we would go to the next one, and then we would hit the antiox. We would switch our tip.
Mm-hmm.
Okay. Then we'd hit on. And then that was the hydration, right?
Correct.
Okay. So then after we do that, off, and then optional. Okay.
And what I want to tell you too, when you're doing a specialty vial, that is a clear tip.
Okay.
So, you know, the teal tip is only for your acid peel and your extractions.
Okay.
Yeah.
And
So
what do
we're
we
not
begin
going
with?
back
The
and forth
blue?
with tips. We're kind of going in order.
Yeah, exactly.
Because we start with blue.
You
The
start
big
with blue.
blue.
Okay.
Start with thick
And I
blue.
always set them up right here. I go blue, teal, white.
Okay. Cool.
Yeah, white, clear, whatever. Unless you want to do the orange peel for your
More aggressive.
more aggressive male skin. Or like if you're doing a back, I would
And
recommend.
you start with this instead of the blue.
Yeah.
Okay.
And then you won't use blue at all.
So blue and orange are the first ones.
Yes.
Okay.
So with the orange, like for that client that has that real resistant thick skin, orange.
Yes. And, you know, you probably won't use orange very often.
Mm-hmm.
But again, if you have like an athlete in here or, you know, maybe a gentleman with like a heavy beard,
Oh
you can
yeah.
go right over the hair.
Okay, I was gonna say, can you go through the
do
beard
that.
one?
Now
Okay.
just keep in mind, usually
But
we
a
have
short beard, not like
Yeah.
Duck Dynasty.
Would we tell them to shave the day before?
you can. They can actually shave immediately prior to
Oh,
the
okay.
treatment. Like
Because
my
it
boyfriend, he
loses the
shaves,
course of yellow-
you know, minutes before I give him a
Because
treatment.
it's anti-inflammatory.
Yeah.
Okay. Cool.
And a lot of times, if they have a Duck Dynasty deal, I
Yeah.
wouldn't waste a consumable on that part of their
No.
face.
Yeah.
They're
Right.
covering that for a reason.
Yeah.
You know.
Right. Shampoo that thing.
That's how you can maximize the treatment.
Yeah.
Put some conditioner on it,
Right.
braid it.
Okay. Cool. So okay, awesome.
Nice job. You
Yeah.
guys did great.
Yep.
Cool.
So the add-ons, if we do the add-ons, are going to be the specialties and our LED. Those are going to be our add-ons.
Yes.
cool. And we'll learn that with our models.
Absolutely. So let's just talk to it real quickly before they get here.
Okay.
When we pop these in, we're going to turn that. So your Brightenol and your Derma Builder are spot treatments. These are spot treatments. So your Derma Builder is going to go in injectable sites.
Oh, okay.
Okay, so here, 11s around the eyes.
Okay.
All right. They may not need it in all those areas. Kiss and twist only with
Oh,
this.
Okay.
Okay, so we're literally creating a nice, plump, full effect in those areas. Does this last as long as Botox? Absolutely not. But this is an excellent thing to do prior to.
Are people
Or
scared to do injections?
Well, if they're scared to do an injection, yeah, or they're just not quite ready to go that route, or maybe they just have a special event that night or the next day, you know, and they want to just kind of plump up their collagen a little bit. This is the way to do it.
Cool. Okay.
And
Okay.
that one we can use on the lips.
Yeah, well, I would go around the lips. I wouldn't
Around
go
the lips.
directly on the lips,
Okay.
but I would definitely go around the lips.
On the
Yeah,
border.
Okay.
on that Cupid's bow, and then
We'll have to do that to Dawn.
Yeah, and like it's especially great for like around the eyes. Again, this is probably as close as you're going to get to the orbital bone, but you're still not going to go quite under the eye. But you can do your kiss and twist, and then kind of take your ring finger, your soft finger, and just kind of
Maybe
dab
she'll let
it.
that for her eye.
Yeah.
Yeah.
So
She
is that
struggles with
before the antiox?
Yes.
Okay.
Yes.
So when we're patting it in, then when we go to the antiox, you're just applying that on top. Okay.
Now, what I like to do, and this device doesn't necessarily tell you that, is I actually like to switch my LED light therapy and the antiox. So after I do the booster vial, I'll do the LED light therapy.
Okay.
Just to really penetrate this into the skin. Okay.
So then would you do
Oh, okay, perfect.
would you do the LED light therapy twice?
You certainly
We're
can.
going to pause for now and we're going to come back and start with the next treatment, so stay tuned.